and this automatically causes the suture to take a deep bite, resulting in the eversion. As you can see, I am approximately the same distance on both sides of the wound. Once this is tied, and you don't want it too tight, you then tie the second knot, and when you're just about down to the other knot, lift it so that the second knot ties on the first knot, so that you are, again, not too tight. This prevents necrosis and cross-hatching or railroad tracking. With Prolene, which is what I almost exclusively use, I tie approximately 4 knots like this and then pull the knot to one side. And I cut both ends just long enough so that whoever is going to remove the sutures has something to grab a hold of. Now, the second suture is a reasonable distance apart. It depends on who you talk to as to how far apart it should be. Some plastic surgeons put sutures very close together, but essentially a half a centimeter is a good distance between sutures, sometimes farther. And as you can see, the first time I tie the knot, I go around the tool twice. The second, third, and fourth times, I circle once. And again, I lifted up the knot on the second time to prevent the wound from being potentially compromised by too tight a knot. And this results in excellent approximation of the wound margins. For an instrument tie, with the first stitch, the needle goes through the wound margins. The thread is wrapped around the instrument twice in the forward direction. The end is grasped, and it's pulled off the instrument and laid down, not tight, but right on the wound. The second throw goes over once. The end is grasped, and again it's tied down, and then forward, one loop over the instrument, forward, tied down, one loop backwards over the instrument, and usually 4 or 5 of these alternating ties produce good wound strength. Subcutaneous sutures are used to give strength to the wound, and this is the technique. You simply enter one side of the laceration superficially, come out deep. On the opposite side, you then enter deep, exit superficially, making sure that both sides of the suture are on the same side of the loop, and you tie this, which pulls the wound together very neatly. Now, I prefer buried subcutaneous sutures, particularly in the oral mucosa, because that leaves no knot near the surface. I also use these on the face because there's no palpable or visible knot through thin skin. And again, usually 3 or 4 knots. I prefer 4 knots is enough to give good tensile strength to the wound. A running stitch is an efficient stitch to become comfortable with because it's rapid, probably 2 to 3 times faster than simple interruption.